All right. Hi, everybody. Dr. Tom Colletti, a physician assistant. So I've been a PA for a long time. I graduated back in 1980 from the U.S. Public Health Service PA program. Of course, I was 12 when I graduated, so I'm not as old as it makes me seem. One of my neighbors in Brooklyn when I was growing up was a physician. I lived 2 doors down. And he actually became kind of like my foster father. He was a big role model in my life. And I got my first job out of college as a research assistant in public health. And there was these guys walking around with little short white coats. And I said to my physician I was working with, "Who are they?" And he said, "They're PAs, physician assistants. And there's a program here." I said, "Can I go?" And he said, "Yeah, I think so." So I applied, and I wasn't the greatest student in college, but one of the physicians I worked with was on the admissions committee, and the rest is history. October 6th, 1967 was the date of the first graduating class from the Duke first PA program. Also, it happens to be Dr. Eugene Stead's birthday. And Dr. Stead is the pioneer creator of the PA profession, along with Dr. Harvey Estes. October 6th is Dr. Stead's birthday. And so Duke University had a huge birthday party for him at lunchtime. And he would come with Dr. Estes and all the other dignitaries, and we would all be invited, of course, and we would listen to him talk. And I met him a number of times and talked with him and shook hands. And he would get up on the podium and start to talk, and he would talk, and he would talk, and he would talk. Even in his 90s, he was very motivational and challenging the PAs every time he spoke to be innovators in medicine. Dr. Reggie Carter was one of the first program directors at Duke, and he was there for a long time. Wonderful man. And I had him come to Campbell University on PA Day to speak to my students about the history, because he was the history. And he had a presentation called Disruptive Innovators. And so disrupting the healthcare system in order to innovate it. And right, not everybody needs an MD degree. There are other ways. One of the great things about the PA profession is its flexibility. And so I started in pediatrics, and then I got interested in emergency medicine. When I moved from Cooperstown, New York to North Carolina, I started practicing urgent care, student health, orthopedics, and my favorite was primary care, sports medicine. So I was a PA doing well, and I realized that I really liked teaching. And so I had a number of preceptors, students that I precepted. I precepted PA students and nurse practitioner students and physician students. And I realized that I really would like to pass on my years of experience to impact the healthcare system more than just by me seeing patients. I want to train other PAs to see patients. And so my first academic environment was at Methodist University in North Carolina. I then became academic coordinator at the Duke University PA program. And I was recruited in 2009 as the founding director of the Campbell University PA program. I was there for 8 years or so and developed an interest in online education when I got my doctoral degree. And serendipitously, one of the other faculty at University of Lynchburg contacted me and said that there was an open position for an online remote faculty member. And so I took that leap, and it turned out to be a great adventure. The dramatic change in the profession. When I first graduated, nobody knew what a PA was. I sent out 150 CVs, resumes. I didn't have a CV then, resumes all across the country. And I got 2 responses. One said, "We heard about this PA thing and we were thinking of doing it." And then the other one was up in the Adirondack wilderness, and I ended up taking that. I remember talking to a neighbor one day, and I said, I'm a PA, just finished the PA program. And he said, Police Academy? And I said, no, physician assistant. And so when I first started, you'd walk in the room and you'd have to say, I'm Mr. Colletti, I'm a physician assistant. And then they would say, what is that? And say, well, it's like 2 years of medical school instead of 4, and we work with a physician. And then, so I'm not a doctor. And then they would say, so when are you going to be a doctor? I said, oh, I'm not going to be a doctor. I'm a PA. And, you can call me Tom or Mr. Colletti. And then at the end, they would say, okay, thank you, doctor. And you just couldn't get them to grasp it. Now, when I talk at groups, I say, how many of you have been treated by a PA? And almost 100% of people raise their hands now. So it's a dramatic change. I kind of wish that I was starting my career now, because there's so much more opportunity. But we were the originals, the pioneers, and they're moving on our backs to get their positions. And so the old timers are indispensable. Tell them if you have a passion, I definitely want to do OBGYN, I definitely want to do surgery, then do it. But if you're a little bit unsure, I say get a job in primary care, family practice, urgent care, emergency medicine, pediatrics, something where you're doing a little bit of everything in medicine to really hone your skills. Because if you go right into orthopedic surgery, you're not going to know too much about handling diabetes and hypertension. So I usually recommend that in the beginning. A lot of PAs ask me also, what about a residency? And residencies are not required. You can do them specifically to get into high-level positions that are looking for experienced people. So you want to do cardiovascular surgery. And they say, well, we're really looking for somebody who can come in and start working. We don't have the time to train you. And so getting that cardiovascular surgery residency opens the door. So there's a lot of things to think about as far as that. Now, the add-on doctoral degree that is at University of Lynchburg is a great option. And I think it's a little bit more specific than mine, which is a Doctor of Health Science. And so if I had known about this many years ago, it didn't exist many years ago when I got my degree, I would have done this because I think it's just so much more appropriate. So my recommendation to PAs out there is that all PAs should get doctoral degrees, especially when you're young and starting, because we're not sure how things are going to change. Optimal team practice. The AAPA is approaching all of the medical boards to try and change legislation so that we have more, not independence, but more able to practice at the top of our license, as people say. And so things are changing, and it's changing for the best. Happy PA Day.
Happy PA Day from the University of Lynchburg.